Yo, yeah, I know what time it is.
It's like a little noise. Freedom. Maybe. Believe my vision. Ready? Decide.
Well, hello there. You are listening to Society Bites Radio. I'm your host today, Jill Krieger, and this is the SRQ exclusive radio show. We are a group of people that network together, and we pride ourselves in bringing professionals who are passionate about helping local businesses prosper through making connections with other businesses and their ideal clients, both locally and nationwide. And today I'm excited to bring you Dr. Ashby. Hello, how are you doing today?
Good morning, Jill. Good morning, everyone. Happy to be here with you.
Oh, we are so happy to have you. And I'd love it if you would just share a little bit about yourself, your background, where did you come from? Because I know you have a really neat background.
Great. I'll be happy to do that. I am a Western-trained physician, grew up in Haiti, came here when I was 12, and have been in Boston, Mass. I went to college there and then went to New Haven for medical school and stayed at Yale for training in internal medicine and loved it there. However, the cold brought me to sunny Florida, and I've been practicing medicine in Florida for the past 10 years. It's becoming more disease management in the practice of medicine than health and well-being promotion. So a few years ago, I made the switch myself by becoming a bodybuilding athlete. I didn't have time to do a lot of health activities, and that became my go-to, and I've been hooked ever since. So nowadays, I'm transitioning to health and wellness in the outpatient setting and helping others make the same switch for their lives.
So important. I love all of that. And so let's touch on first the healthcare industry right now. I mean, because we don't need to go into all of the politics, obviously, but let's go into the reality of it's really not healthcare, it's sick care.
Yeah, unfortunately, it's not just the physicians that realize that, it's also the patients. I decided to go into primary care because I wanted to help the underserved. I was an idealist when I left medical school. And after leaving the North and coming to Florida to begin my practice and career, I realized that I really had very little time to help patients make the necessary changes that would promote health. I found myself managing disease all the time because we had no focus on promotion of health. So I've worked in various settings. I left the outpatient for that reason because we were starting to see way too many patients per day, about 37, which if you imagine 8 or 9 hour day seeing 37 patients, it's not healthy, but it's happening at a lot of clinics, unfortunately. So I went to the inpatient setting, and there again, it was a lot of disease management, didn't have time to spend on discussing quality and reversal of chronic diseases like diabetes, high blood pressure, obesity, high cholesterol, the most common things that bring people to the hospital with the most common thing that kills people in America, heart attack. So a lot of you who might be going to the doctor may experience the rush factor. Some do have great experiences, which we want to cherish, but I keep hearing too many stories of the bad experiences. So I'm trying to, as many other doctors have, take a step into the wellness side and see if we can create more activity there for patients to enjoy.
That's really one of the big things, I guess. Where is that line of the sick care to the well care, of how can we make a difference? And all of those things that you mentioned, so many of them are actually lifestyle.
Oh, yeah. Yeah, absolutely. That's what it comes down to. And there's lack of information. Some people might want to check on their diet and not know where to turn to. And their doctor, of course, may not have the time to spend with them on that. And you have to pay out of pocket or outside to get a dietitian sometimes. Or you have to be really proactive in your healthcare to find out where the resources are. There are in the community, but you need a little bit more proactive search to find them.
Absolutely. And unfortunately, I know that you know this is because you've educated yourself after med school, but in med school, you're not taught about nutrition.
Unfortunately, no, not that much. At Yale, I have to say there is one great doctor who prides himself on helping the med students in nutrition. And I remember having one course in medical school. Can you imagine? So that's 4 years, one course. And then in training, which is an additional 3 years, there is no curriculum on nutrition. So yeah, it's a very, very quick exposure. So for any doctor to have additional knowledge, it would have to be self-taught afterwards. They do have all of the background to add that knowledge, but it's not something expressly focused on in med school or after. So those who are prevention doctors, they make it a point to either get additional training, certifications, or self-teach to help their patients. And that's a major aspect of helping everyone. As you know, in chronic disease, in obesity and cholesterol and diabetes and high blood pressure, a lot of times we're talking about losing weight, and that often comes down to what are we eating. And managing blood pressure, same thing, and managing cholesterol, same thing. So the nutrition piece is very valid, and it's one missing key in a lot of practices. And one of the reasons even doctors have to make a conscious change to help patients get better by changing their model of practice altogether.
I think you touched on that, and that's huge, of the difference of going to a doctor that is preventive, proactive, of creating health as opposed to managing being ill.
Yes. All doctors are able to manage the diseases when they come up because they're trained in that. Most of them will know what to do. But the momentum of the industry is such that when a patient presents, the automatic question is, what are the symptoms? So that the automatic answer can be, here's the pill that can help relieve that symptom. When there's less time, there's more of that automatic response to symptoms. Less time means it's more difficult to dive into the root cause of certain medical problems. So it's both the patient and the doctor that are being driven to that end. But when the physician has time and their intent is to help reverse disease, their approach is very different, and the patient experience is also different. You can begin to see people come off medications for blood pressure. A lot of patients do want to come off medication for chronic disease, but just don't know how to do it and want to do it safely with guidance from a professional. And they have to seek out those professionals.
That's huge. And so I think that the great news there is that you can reverse a lot of disease.
Absolutely. It's well known that many of the chronic diseases that we in America suffer from are stemming from the lifestyle that we lead. Many of us are busy. Many of us eat the foods that are mostly available. and those lead to chronic disease by way of poor nutrition. So luckily, a lot of that can be reversed. I love taking care of patients who have early diabetes or pre-diabetes or first stage high blood pressure, because a lot of these things can be reversed. Obesity, which can lead to heart disease eventually, that can be reversed. So there's a lot of opportunity to improving healthcare in America if we're able to focus on the reversible chronic diseases. And I think that's an exciting field that a lot of physicians who initially wanted to do primary care are looking to get back into, that prevention, that wellness, and root cause-based medicine.
Yeah, and I think that's probably a huge thing of a doctor goes into medicine because they want to help people, and they find that when you come out, that's not necessarily what you're doing.
Yeah. Unfortunately, this is one of the reasons many doctors who are in primary care are unfortunately unhappy. And we have had reports that physicians now, primary care physicians, are among the highest at committing suicide. Professional suicide in this country is highest among our primary care doctors and ER physicians who are seeing this high volume of patients, really going against the grain of what they went into the field for initially, and really, frankly, thinking there's no way out. It is an individual choice. I've been there myself at the breaking point where I realized this is not what I signed up for, and it had been 10 years into my medical practice, and had to make a conscious change towards what I wanted to do with medicine. Medicine is an incredible field. It has a lot to offer, but as physicians, we need the time to spend with our patients to be able to provide those results. And the volume-based practice that some insurance reimbursement dictates it makes it difficult to see 25 or 30 patients a day and give that quality care. So you'll see many physicians go to seeing a much smaller panel of patients so they can have that satisfaction of truly helping their members and patients.
I did not know that statistic about the suicide. That is just horrible. I just can't even fathom.
Yeah. At some point it was dentists, and then physicians surpassed them. And the two specialties that are at the highest risk include primary care and emergency. So it's felt in the physician community, and many are making the change towards wellness, which is good. Mm-hmm.
It's also, and I think it's driven in both directions. The doctors wanting to be able to actually practice medicine and helping people, and people starting to take on personal responsibility.
Yes. So as much as the healthcare industry issues and problems may be ballooning, in the disease management realm, I think it's very exciting when you come out to the prevention side to see patients who are willing, able, motivated, but just need guidance. And it's a very exciting practice, again, to be able to partner with patients and help them get the results that they're looking for. So I think there's a lot of hope. And the formula may be to get out of the constraints that is forcing the poor behaviors on the physician side.
Yeah, no, that makes a lot of sense. So how do you, as a physician, incorporate the fitness and the nutrition into your medical practice?
Well, it's very interesting. I am also a professional bodybuilder in the IFBB League, which is the International Federation of Bodybuilders. And I've been doing that for 5 years. On the side, as a professional bodybuilder, I've been helping clients